Good morning. Today is World AIDS Day, and we're going to be talking about a very particular interesting topic about demystifying stigmatization and living with HIV. So I'm Dr. Oshino Magnus Adilani. So we just give a brief summary of everything that we need to know and stigmas that occur around HIV. Okay, so I have my slides with me. So I'm the senior medical officer at St. Emmanuel Hospital, and I'll be talking briefly about some major issues that need to be addressed, particularly on these very important things. So, first and foremost, we need to talk about what is HIV and also what is AIDS. So basically, the human bodies have what they call armies that helps to fight against infection. And these armies, they protect the human system from attacks. So what is the major army of the body is the CD4 cells. And these CD4 cells, they are the ones that are responsible for fighting infection. So how does HIV, how does it work? What it does is that it reduces this amount of cells that help in protecting the body from these vulnerable illnesses in which they face. So sometimes when people come or when you hear people around you, you sometimes worry that HIV, AIDS, are they the same thing? So what I just want to demystify or to elaborate more is the fact that HIV and AIDS are not the same. But we know from the word HIV is human immunodeficiency virus, and AIDS is acquired immunodeficiency syndrome. So at the initial stage, what we have is the HIV. So down the years, as it progresses into what is called AIDS. So AIDS is more or less like an advanced stage of HIV. So what happens when it progresses to AIDS? The immune system is severely weakened. So one of the things we need to stress and expatiate more is that HIV is now manageable. And with the advances in medicine and the pharmaceutical industry, they've been able to come up with what is called the modern antiretroviral therapy. So people can live with HIV even for years. They can live healthy, productive lives. So even recently, I think that there's even advent of injections that can even prevent people from even having the virus itself. So, but very soon, hopefully, I think we should get it in Nigeria as well. So, like I said earlier, AIDS is the late stage of HIV. So this happens only when HIV is untreated. So what does that entail? That entails that the earlier, the faster one gets detected, the years one can live. So when do we know, or how do we characterize this as HIV? At what level, at what stage do we treat this? So normally in the past, back in the past, they would say until your CD4 count gets below 200, that's when people should start get treatment. So, but now, once they detect that you have HIV, that's the virus itself. They don't go by this criteria anymore that the CD4, which is the cells that sounds like an army that protects infection from getting into the system, they start the treatment immediately. So we've been able to differentiate between HIV and AIDS. And we know that AIDS is the latter stage of HIV. So how do we prevent everyone encompassing from getting to that late stage of AIDS? How to do that is by early diagnosing and strict adherence to treatment. So what do I mean by strict adherence to treatment? So once they detect that an individual has HIV, we place them on the antiretroviral therapy. We give them the tablet and we tell them to take that tablet, at least one tablet every day at a particular time. And we also talk about other issues when it comes to couple therapy or partner to partner treatment, and how this can also prevent it from progressing to AIDS and also spreading to other individuals as well. So, since the advent of HIV and AIDS in particular, there's been lots of rumors, lots of misnomers, lots of misinformation everywhere. So I'll just try to elaborate more on all these misnomers and how we can curtail this. So most people still believe that HIV can be spread through casual contact. Some believe that when you kiss your partner or you kiss your wife, you could have this. But this is actually very wrong. And even some communities also associate HIV with immorality, which leads to discrimination, which is also very wrong. So we need to educate these people, and this is why we are creating this awareness on our 50 years anniversary in St. Emmanuel, so people can be informed about this information and these misnomers that are everywhere, demystifying these things. So when people are not informed, what happens? Stigma thrives. So there are different forms of stigmas. I would also talk about that sooner, and we'll see how we can prevent that from happening. So we look at, if you can see from my screen, there are different stigmas, which is self-stigma. We have the social stigma, we have institutional stigma, we have healthcare stigma, and we also have structural stigma. So let's talk about self-stigma. So in self-stigma, individuals internalize shame and begin to see themselves negatively. How do you see that? So take, for example, a patient comes in and they find out, oh, I've got HIV. Immediately in our environment or in our community, they're being destigmatized. They look at them as being different, but that's not the case. I've seen individuals live with HIV for years and you won't even know. It's not written on the face. So we need to prevent such stigma from going around and also looking at such people as being different. Also, let's say a particular member of one's family or a friend and they see them as being HIV positive. What happens? Then now the community rejection comes into place. You see people gossiping, talking, distancing themselves, or excluding themselves. That shouldn't be the case. And people need to be aware of this. So how do we elaborate on that? Even we can see in our hospitals and even in the bigger hospitals, like the teaching hospitals, they've created ways in which to curtail this. Instead of putting HIV/AIDS, they use other names, more modifying names, so that it doesn't stigmatize these individuals. They're also human beings as well. Just that they have this virus, and the best thing that's ever happened now is that there's even medication and invention to prevent this from happening. So when you have things like this in your workplace, how do you view these people in your schools, in your companies, in your organization? How do you see them? Do you stigmatize them? No, we shouldn't. So even within the healthcare system, like we have in the hospitals and in the clinics and all, we shouldn't judge or treat them differently. They are also one, just like they have this virus, and it is preventable and also can be prevented from also spreading to other individuals. So we need to make people aware of this and put systems and policies in place to prevent these people from being stigmatized. All right, so we've talked about all the stigmas, so we should put this into consideration and see how we can address all these issues, okay? So one of the things that would like to elaborate more is what they call delayed testing. And how can we do that? We should put systems in place that every individual that comes should be tested. Why is this important? This is very important because when the more people are tested, the more people find out about this, and the more it's prevented from spreading to other individuals. So people need to avoid testing. People avoid testing because they fear being labeled. But that shouldn't be the case. We should encourage people to test more so as to prevent the spread. Even WHO has elaborated more on that, that every individual should go on free testing. That's what the World AIDS Day is all about. So people are also stigmatized because they also the fear of seeking treatment due to discrimination. So some patients, they hide their status and refuse to take the medication openly. And we can see that in our day-to-day society, especially within couples, because sometimes this causes what they call emotional trauma, which could lead to depression, anxiety, shame, and even suicidal thoughts. So when all this happens, when we have delayed testing, the fear of seeking treatment, and the emotional trauma, what now happens? The virus starts to spread. So that's why the World AIDS Day is to make people aware and to prevent the spread of HIV. So this stigma leads to silence and denial. And when this is not checked, there's transmission from persons to individuals to families to couples and all. So one of the things that we need to also be aware is that HIV cannot be spread by sharing utensils, by kissing, by sharing food, or using the same toilets or using the same bathroom. So this virus does not survive outside the body. So normal daily contact is safe. Also, I had to bring this very important one about mosquitoes because some people feel like when mosquitoes bite X and bite Y, then HIV could be spread from X to Y, but that's not the case. Mosquitoes only transmit malaria, yeah, but cannot transmit the virus because HIV cannot survive outside the body. So I've brought this very important you, that's undetectable means untransmittable. So when you do your CD4 count, which is the army, and the level of the CD4 is less than 200, in which we in the health system try to bring the CD4 level down to curtail it as much as possible, the probability for it to be transmitted, even as a couple, to the next person is zero. So a person whose viral load is undetectable cannot transmit the HIV sexually. So how can this be done? By early detection, being on medication, removing the stigma. So this will prevent the HIV from transmitting from person X to person Y. So how do we do this? Like I said before, we're still elaborating on that, is by daily adherence to antiretroviral therapy. So this keeps the viral load low and protects the immune system. So we need to also create a system where we need clinic checkups from time to time, from day to day, from month to month, regular follow-ups, investigation, treatment, and all to monitor that the medication is working and that the individual's health remains stable. And also, we can also engage in healthy lifestyle. How do we do this? By good diet, exercising, sleeping adequately, at least 6 to 8 hours of sleep, and also mental wellness support, and also immune strength. So these encompass and create a good support system with the help of our families, our friends, the doctors, the nurses, the health workers, the peer groups in encompassing would all reduce this stigma and reduce depression and isolation. Even normally, even let's leave, remove HIV from the case, just being isolated could also bring the immune system of such individuals down and also could cause more health problems. So we need to show what they call empathy. Empathy shouldn't be left aside. So the way we treat the patient, the way we treat our friends that live with this condition. They should feel safe and free and respected within the society. When sharing their status, we shouldn't destigmatize them. We shouldn't stigmatize them. So we need to maintain confidentiality. When someone comes to you and tells you about their status, how do you see them? Do you go about gossiping and telling others that, oh, see that person just HIV? No, we should welcome them with open hands because breaching confidentiality increases that stigma and also discourage such individuals from testing. So we need to create an environment of awareness, of educating people, even within us, within the health system, to counter these myths with scientific facts. So we need to encourage testing and treatment. So when we normalize HIV testing as a routine healthcare, what's going to happen? We're going to win. And how do we do that? By detecting prevention of transmission of the virus from individuals and adherence to treatment. So there are some very keen, particular things that need to be noticed. How do we engage? What kind of language do we use with these individuals? I try to make my presentation as simple as possible so that everybody can be able to understand instead of using the medical jargon. So what's like clean versus dirty to describe HIV? Oh, you dirty. No, that shouldn't be the case because um, that's very harmful and that could also further isolate these individuals. So like I buttressed earlier, we need to promote openness, conversations about HIV, reduce fear, and increase acceptance. So I've already addressed this earlier. So we need to create means to support people living with HIV because these boost their confidence and emotional well-being. I've seen patients live with HIV 20 years, even couples, even those living with HIV, and prevention of mother to child transmission. So they need all the support whatsoever within the HIV community. And how do we do this? Also encouraging the youth on educating them. And also, when we do this, there's less likelihood of the stigma from being spread to other people as well. So we need to create like an awareness program that helps to debunk the myths and reduce the fear, and also training of the staff as well. So when we regularly train the staff, it will build a stigma-free healthcare environment. So when someone comes in and wants to do a HIV test, how do we see them? Do we stigmatize them? The answer is no. So we need to also create support groups. There are many support groups that also helps with this so that people living with HIV do not feel alone. They can be able to connect with others and doesn't make them feel isolated. So confidentiality assurance, this is very vital because it creates a safe space that improves patient adherence and follow-up. So, like I said, HIV is manageable, the stigma is preventable, the knowledge is the strongest tool against discrimination. And I believe, like I said, we've been able to expatiate and elaborate about the difference between HIV and AIDS, that it can be spread by kissing, by sharing the same toilet, using the same utensils, and preventing this stigma in all facets of our community, our social life, within the health system, and within the society. Together, we can build a stigma-free community. So I've been able to address all the issues, and this brings me to the end of this beautiful, lovely, educative presentation on this lovely, wonderful day on World AIDS Day, this demystifying HIV and stigma in the society. Thank you so much.